I'm going to talk to you guys about pharmacists, and I'm titled my presentation to the dispensary and beyond, your pharmacist role in side effect management. So a lot of stuff that I'm going to talk about is stuff that the previous two presenters have been covering, and because it's a team effort, a lot of the roles do overlap, but this is in best interest of patient care. So I'm going to talk to you about what pharmacists do in the cancer center and help you understand how pharmacists can help in drug management and side effect management. And at the Tom Baker in Calgary, we offer this Oral Chemotherapy Management Program, and I'll explain that to you as well. And finally, I'll end off talking about certain drug interactions that can occur with your kidney cancer chemotherapy. First of all, if you're a pharmacist at the dispensary, other than saying, oh, just 15 more minutes, or taking pleasure in making you guys wait, we actually do take the prescriptions and try to make sure that they are correct. We try to identify any certain drug-related problems and make sure the dosing is appropriate for the patient. When prescriptions are filled, whether that being your regular tablets like oral chemotherapy, or if it's mixing chemotherapy in the sterile room, we make sure the orders are made properly and correct. There's safe medication handling, and also we try to minimize drug costs by trying to minimize drug wastage. Also, at the pharmacy, pharmacists always counsel on new medications at the Tom Baker to the patient. We teach the patient about how to take it, when to take it, why they're taking it, and side effects. Patients, when they first get diagnosed and when they're first starting new therapies, they probably already heard it through their oncologist or through the nursing, but it's just overwhelming for the patient. So hearing it over again doesn't hurt the patient and gives them more information to empower them to handle their therapy at home. When the patient leaves the pharmacy, they can call the pharmacy at any time or drop by if they have any drug information questions. And that's how pharmacists act as a drug information resource. They might ask questions about their chemotherapy or maybe about other drugs that may interact with their therapy. They also, most of the time, do call and ask about side effects, and that's where I'm going to talk about pharmacists' role in side effect management. When patients call, they ask about certain side effects, and pharmacists can help them identify and report common and rare side effects. We are here to help assess the severity of side effects, and if we decide or need be, we can seek medical intervention, whether it's seeking your physician or some sort of other healthcare professional. We can also discuss and review certain side effect management techniques and recommend therapies that may help make your chemotherapy treatment home more manageable. This brings me to the Oral Chemotherapy Management Program. So in Calgary, we offer a phone follow-up program to help monitor patients' side effects and toxicities. This is more a regimented follow-up where we go through every single toxicity with the patient, and the toxicities are graded in accordance to the trials that have graded the toxicities before, and they're documented in the patient's electronic chart for other healthcare professionals to make reference to. We discuss with the patient side effect management strategies to help them feel better at home, and if the severities are really severe, we will contact the physicians for them. So which drugs do we include in this? This would be the more high-risk oral medications. So these are medications that can cause serious harm to the patient, whether taken properly or even misused. And the whole talk we've been having today would be like the oral targeted therapies for metastatic renal cell carcinoma, but also other drugs we include for like breast, lung, GI, and hematological cancers. The ones for metastatic renal cell carcinoma would be your sunitinib or Sutent or sorafenib, which is Nexavar. The reason why we started this program is because we were noticing that there were more novel oral chemotherapy agents coming to market. These agents, like Dr. McKenzie said, have very good outlook for their cancer treatment, but they do have with coming to them side effects and toxicities that can be concerning to the patient. That's why we want to have a more proactive and as well a reactive approach to side effect management. Before, patients would just call in asking about their side effects. By doing a proactive approach, we're trying to catch these side effects from occurring before it gets too severe, and reactive by trying to manage them at home. We educate the patients about these management techniques using drug as well as non-drug measures that Mr. O'Brien has discussed, and kind of go over those ones again with the patient. This will help try to optimize the drug therapy, trying to keep them onto the drug as long as possible, and ultimately try to aim to improve the patient's quality of life. So when do we usually call the patient? Well, it usually depends on what drug that they are on. But for Sutent and Sorafenib, we call them definitely in the first cycle on a weekly basis, usually first, second week, and third week if necessary. Sometimes then they'll see the oncologist around the third or fourth week. Further cycles, like cycles 2 and 3, we might follow up at the second week or more. We also follow them if there has been changes in their doses or if their doses have been delayed. Patients, however, are notified that they can call the pharmacy at any time if they have any questions or concerns. So what have we found out from this program so far? Well, most of the side effects initially that do arise from taking these targeted therapies are manageable by non-prescription methods. And Mr. O'Brien went through some of those management techniques with you. By teaching the patients again and kind of drilling them on these management techniques, they can be more manageable at home, and they seem to do a little bit better. However, there are times where we have to contact the physicians as the side effects have become more serious to the patient. At those times, we might recommend certain prescription medications that the doctor write for us, and then we can fax it to the patient's pharmacy so then they can start this extra medication as soon as possible. Sometimes a doctor might inform us to tell the patient to hold their medication to let them recover from their side effects, and other times they might even want to bring the patient into clinic sooner than their scheduled time so that they can assess the patient themselves. And how do the patients feel with this oral chemotherapy management program? Well, the patients feel that they're more empowered to manage and monitor their side effects. They know they're not alone at home just taking these pills by themselves. Callbacks help educate these patients how to deal with the mild side effects, and they let them know when to call us if the side effect worsens. They also are taught monitoring techniques to keep an eye on how their side effects are progressing. For instance, they're told to have medication diaries, and for sunitinib, like you probably already know now, it can increase blood pressure. So we do recommend patients to take their blood pressure and record it for the physicians and other healthcare professionals for follow-up. And the last part of my talk is going to be on drug interactions. There's different types of drug interactions. The one we're going to focus on are drug interactions with other prescription or non-prescription medications. The types of drug interactions that are out there are, the first one would be like synergy, which is one drug can boost the effect of another drug. The opposite would be one drug negating the effect of the first drug. Other drug-drug interactions may include altered drug metabolism, where it can be increased or decreased, and also one drug can also alter the absorption of another drug. There's an indirect drug interaction where two drugs may not have a direct interaction with each other, but they might have overlapping side effects or toxicities. This is known as toxicity duplication. So what happens with these drug-drug interactions? Well, possibly there can be an increase in drug level concentration within the body of one drug, or might even get decreased. This might affect the therapeutics of that drug, and it may even make the side effects or toxicities a lot worse. Or else sometimes the drug-drug interaction is just theoretical, and there might not be any clinically significant effect. So it's always a good idea to check with the pharmacist first. So what are some common culprits? Well, with your kidney cancer chemotherapy, such as sunitinib, sorafenib, temsirolimus, and everolimus, these get metabolized by certain gut and liver enzymes in the body, and these liver enzymes can be affected by certain drugs. And these drugs may induce the enzyme, meaning it can increase the metabolism, and by increasing metabolism, this can decrease the level of drug in the body and effectiveness of your kidney cancer chemo. Such culprits of metabolic inducers would be like, significant one would be carbamazepine and phenytoin. These are very strong inducers of the enzyme. Phenobarbital, dexamethasone, rivampin, and even a herbal medication, St. John's wort, is known to induce these enzymes as well. So we should always check with your pharmacist first and let them know what medications you're on. On the flip side, there are medications that can inhibit this metabolic enzyme, thereby decreasing metabolism, increasing the level of your cancer chemotherapy in the body, and also increasing toxicities. Certain culprits would be like your antifungal agents such as azole antifungals like ketoconazole, can be your antibiotics like clarithromycin, certain HIV drugs like protease inhibitors, and even certain juices, more in particular grapefruit juice and pomegranate juice. These are moderate inhibitors of the enzyme, but we do recommend against drinking the juices with your chemotherapy. Another thing is that there's some side effects that can be duplicated with your oral chemotherapy. And for instance, you can have increased bleeding risk with warfarin, which is a blood thinner. And we recommend patients that are on these blood thinners to get their blood tested more often. And also non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen, naproxen or Celebrex. And aspirin and ibuprofen are over-the-counter medications, so always be aware that you should tell your pharmacist about these medications that you are taking. There's other drugs that are more, that can duplicate your side effects with sunitinib, such as amiodarone, sotalol, and moxifloxacin, and this can lead to a cardiac problem called QTc prolongation. We usually caution with use by combining those two medications and check with your doctor first. And like Dr. Mackenzie mentioned before, is putting two kidney cancer chemotherapies together is unclear about the safety. For instance, there has been shown sunitinib and temsirolimus has increased rash, gout, and cellulitis. And also, there should be known that herbal medications out there haven't been fully studied with your kidney cancer chemo, but there are theoretical risks for increased hypoglycemia with temsirolimus, especially with herbals such as alfalfa, ginger, ginseng, and bitter melon. And lastly, a lot of people want to know, what about alcohol? Can I have a drink of wine with my medication or not? Usually, we tell patients that there is no direct interaction, but it can possibly increase side effects such as fatigue, GI upset, nausea, acid reflux. So definitely don't go binge drinking while you're taking your chemotherapy. So bottom line, let the pharmacist know what medications you're on, including over-the-counter medications, prescription medications, inhalers, creams, and they'll be more than happy to help and check any drug interactions. Thank you. So my first question I got was, do we counsel patients at the beginning of their therapy on potential over-the-counter meds that they can use in the community for colds and flus? So what we do when we have a new patient starting a new medication, we get their list of medications that they're on, and we usually tell them medications they should not be taking. Depending on what medications they can or cannot take, it'd be based on whatever medication that they're starting, like their chemotherapy. Sometimes, if we notice that they do have a heart problem, we'll tell them to avoid decongestant medications. Definitely we tell them to avoid stuff that can increase bleeding risk, so some cold and flu medications that might have ibuprofen or aspirin we tend to avoid. However, in Alberta, we dispense the medications at the cancer hospital, and we strictly do cancer medication. And the over-the-counter medications that are out in community, those brands seem to have new mixtures and new combinations of over-the-counter meds together. So it's always important that you do check with your community pharmacist about the drug ingredients in those over-the-counter medications. The next question I have is, does Zocor or simvastatin interact with sunitinib? And the easy answer to that one is they don't really have a clinically significant interaction. They both get metabolized by the same metabolic enzyme, the CYP3A4, but probably they don't have a direct interaction with each other because they don't induce or inhibit the enzyme to a big extent. Another one was about Pepto-Bismol use with sunitinib, and there's no really direct interaction. You should know that Pepto-Bismol is a salicylate, so there is some thought that sometimes Pepto-Bismol can have some increased risk for bleed, and that might happen with sunitinib. Might not be fully significant, clinically significant, but you have to know that sometimes Pepto-Bismol can darken your stools, and if a person is using Pepto-Bismol for ulcers or GI bleed, that darkened stool might get mistaken, whether it being actual ulcer or just a side effect. Another thing is that with sunitinib, sometimes acid reflux can get to really significant extent where they might be better off with a stronger antacid or acid reducer such as H2 antagonists like Zantac or ranitidine, maybe going up to even something stronger like a proton pump inhibitor like Losec, Pantoloc, Prevacid. Sorry, the third question is, what do you think about naturopathic and homeopathic remedies in addition to sunitinib, Nexvar, or Afinitor? Everything we base at the cancer hospital is evidence-based, and a lot of the studies that are out there do not include herbals or naturopathic medications, so we cannot give an evidence-based recommendation about their use, but we do know if we can look if there is some sort of increased chance for toxicities or if those herbals can affect certain metabolisms. As for homeopathic remedies, like I said, we don't know the evidence entirely, but homeopathic remedies are substances that have been diluted like thousands of times, so may not have a significant harm. And there's something here that says there is a drug called naltrexone, FDA approved in low dose, can boost immune system. I know naltrexone can be used for as an opioid receptor antagonist to go against the use of drug overdoses, and it's saying that it's going to be used to boost the immune system. I'm not too clear about this, and this is a prescription drug that requires physicians to prescribe. Has anyone heard of this or is used in it? As it's used in boosting the immune system, I don't believe that's an improved indication. In conjunction with regular treatment, this is a naturopathic drug. Can be purchased from pharmacy in Toronto. I don't believe that's true. Naltrexone is a drug that is what we call a Schedule 1 drug that has to be prescribed by a physician.